Hi, Joan. Welcome back to the show.
Hi there, you two. It's always just a joy to be with you and to be with everybody who's listening in.
Yeah. It's
Good to
so
see
nice
you.
to connect with you. And today, we discussed talking some about the big process you've been through recently and the near-death experience, and talking about the topic of death and dying and illness and medicine. And so that's kind of we're just kind of here in this, we're going to play together here in this field of what you went through and see where it takes us. So maybe just start us off, Joan, with where you want to start around the process you've just been through. Let's see where it goes.
First of all, I can tell you how happy I am that both my husband and I are alive and well. And on the opposite side of each of us having a kind of mortality risking experience. We just came back from a 5-day hiking trip in the wilderness of Colorado, and it was great. It was a sense of, oh my God, here we are again. We're grounded. We're so grateful to be here. So, in a nutshell, what happened was that in the spring, my husband, Gordon, had a heart attack. And that's, I'm a cancer cell biologist by training. And I've always been more afraid of cancer than a heart attack. But the heart attack was really scary because it's sudden. It's a totally different thing than facing some more, lengthy or chronic problem that may still be impacting you in terms of you think, well, this is it. This is what I'm going to die from. But being with him, as I saw, my God, I hope the ambulance gets here in time, was a truly frightening experience, both for me as his wife and in a way, less for him. I think until you face mortality, you really don't know what you're going to experience. You may think you do, but you don't. And for him, he had a sense of great peace and a sense of, if this is my moment, I'm ready to go. I don't have any regrets. I accept my life for what it is. I've loved as best I can. And, in spite of, I think all of us look back and we wish like, oh, I wish I'd been more skillful in this way or that. But at the moment of death, if you can accept all of that, it's a great thing. So he was fortunate. As you know, Will, we live rurally, and it takes about 25 minutes for an ambulance to arrive. And then there were COVID precautions when I got to the hospital, so nobody could sit with me. Neighbors had followed the ambulance and come with me, and they had to go. And I ended up alone for about 3 hours in the ICU waiting room. The hospital was quiet. It seemed like deserted. But meanwhile, wonderful things happened. In the cath lab, he got 3 stents. And when he came back to his room, this was now by this time about 11 at night, he was so clear. He was like in a little Buddha state. And I thought to myself, either he's done really well with death or give me some of those drugs. This guy is in like a very pure present state. And that was really remarkable. It made us both grateful for modern medicine that, the stents could come in. And now there was, a period, of course, of recovery. He finished cardiac rehab just recently, so this was about a 4-month process. And I don't think that you're ever the same after something like that. Living with him, there are just so many more moments of looking at each other, of one of us going up to the other. When you know how it is, you're busy in a house, you're there together, but you're not together, you're passing through, you have to return your email, whatever. But of simply stopping and looking at each other and just having a hug because the gratitude is so great. And one of the things for sure that I used to hear my own patients tell me when I was running a mind body clinic, I had plenty of people who had heart attacks, cancer, AIDS, you name it, is how they became more aware of how life is precious. And particularly with their loved ones, took the time to be more loving, took the time to be more present. So that turns out to be a great gift of the experience. Then flash forward 2 months, and by that time he was pretty well recovered. And I found, as you know, a honeydew-sized melon tumor in my abdomen, and went to see a gynecologic oncologist who jumped to the conclusion that it was ovarian cancer, which statistically it should have been. I'm older. The chance of having ovarian cancer increases as you age. But she never gave me any alternatives, like, could it be anything else? And I think one of the things that makes such a difference for people who are facing aging, who are facing chronic illness, or who are facing acute illness from which they think, well, this is it. This could be it. The physician who treats them, of course, the relationship you have with them and how they present things makes an enormous difference to a person's not only peace of mind, but perspective on the illness. And this was a cautionary tale. When I give a lecture for you guys on presence, if I do that again, I'll incorporate what happened, because go into a waiting room of a place that's like a cancer mill, and people are running around with their IVs. And my first thought is, okay, take a few deep breaths and give yourself a break. It's going to take time to accept this is where you are right now. This is your peer group. This is what's happening to you. And mind you, I didn't have any information yet. I had just come from the CT scan. And after about a 2-hour wait, I saw a physician's assistant with my husband, and we sat there. And she never so much as said, hello, how are you? I know this is a difficult time for you, and let me tell you where we are so far. She just said, sit down. She sat across a big desk. She starts to read the report from the CT scan. And it reads terribly. She said, well, the tumor is huge. It's the size of a honeydew melon. It's almost 20 centimeters. And she said, oh, there are large lymph nodes, and there's a spot on your liver. And then her beeper goes off. And she runs out, and she's gone for 10 minutes. She comes back without so much as a sorry to leave you, like in mid-death sentence. And she starts to read the remainder of the report, which is scary. And then finally, the doctor sees us. And by the time I went in there, we were so sure that it was ovarian cancer that the first question I asked the doctor was, do you think I'll be able to live out the year? That was my question. So clearly, something was already wrong because a diagnosis had been implied. When I said to the PA, what do you think it is? She said, well, it looks certainly like ovarian cancer. And that was exactly what the doctor said. Her first words were, "You're in big trouble. This is not exactly a great way to greet your patient." And after saying, "Okay, I want to get you into surgery immediately," she said, "But there is really good news. We're about to start a fabulous, interesting clinical trial, that involves immunotherapy, sort of." And fortunately, because I was a cancer cell biologist for years, because I'm a scientist, because I understand clinical trials, I said to her, have your clinical trials manager send me the protocol. And as you know, that happened. And it was a horrendous trial. It turned out to be a phase 1 toxicity trial, although it was really a phase 1/2 trial because there was a placebo arm to it. And I thought, my God, that would be the end of quality of life. I'd rather do nothing, rather have palliative care than that. And so, fortunately, I knew what the trial was and I turned it down. But it was deeply upsetting to me because the idea that, first of all, they'd scare you to death and then try to sell you on a clinical trial within literally 5 minutes. I thought, oh my God, what about all the people who don't just happen to be trained scientists, right, and who would say, thank God I have hope? And that was actually very deeply upsetting to me as part of the process. I was fortunate enough to find a great doctor about a week later. These 2 doctors were such a study. The second one, sat with me and she said, would you like to see the slides from the CT scan? And she explained them beautifully, especially because my husband has no medical background. He was able to understand everything she said. And from her, we understood it could even be something benign in there. Let's not jump to conclusions. I was lucky that it's a strange beast called a borderline tumor. There's a lot of mitosis, but the kind I have, fortunately, is not invasive. I didn't need any chemotherapy for it. I have a very good prognosis, but it led to a real consideration of death and dying, particularly for a period of about 2 weeks. It was about 2 weeks between the time that we thought this thing was a huge ovarian cancer and the time of surgery when we recognized it wasn't.
2 weeks is a long 2 weeks is a long time. It's a long time.
It is.
Curious, Joan, if you, prior to this, bringing it more to an aging conversation, do you contemplate death and dying often? Is that just something you don't think about a lot? I'm curious, how the process was prior to that moment and then leading into that moment.
Yes. Well, yes, we have both thought a great deal about death and dying. I think maybe more than the average person, because I ran a cancer clinic, I ran an AIDS clinic, I watched people dying. But of course, you never do think that it's going to happen to you. There's a line in the Bhagavad Gita, what is the most amazing thing about human life? I mean, this is such a loose paraphrase, but you think of all the wonders of the world. And the wonder that they're talking about is that you can watch your family and friends die all around you and never quite get that this applies to you, that your time will also come.
Wow.
Of course, when you get older, people do die. You begin to see more of that. But because I'd seen so much of it. And because I had had what's called an empathic or shared death experience many years ago, when would it have been? It would have been about 35 years ago when my own mother died. I had thought a great deal about what is death and what is dying. And of course, they're two very different things. I think most of my patients said to me, I'm not so afraid of death. I'm afraid of suffering during the process of dying. And I'm afraid of leaving my children, leaving my loved ones, leaving my spouse or whatever. And that's the kind of suffering. And what Gordy and I were thinking of, Gordy, in terms of his facing his own death, was in a really good place. He was ready to go. And I was also in a good place. I feel like, okay, I've spent a long time trying to integrate the experiences of my life, the difficult ones that have led to growth, the times when I've really messed up and fallen flat on my face, and then tried to make amends to other people as best I could, and done the forgiveness myself. These are all things we need to do, not only in preparation of death, but in celebration of life, that we can truly be present and loving in this lifetime. So we've both been working on that for a long time, and both very, very interested in the question of, are we just our bodies, or are we something more? Does consciousness survive death? And for me, I think I'm so fortunate, because having been in the AIDS years with so many people who are dying, I've got lots of experiences to draw on. One of them, for example, in a patient, he must have been about 50, and he was a mountain climber. He was in great shape, and he had liver cancer, and he was getting like chemo. He had a pack that he wore on his belt, and it was dropping chemo right onto his liver, literally, and still climbing mountains. And he did not want to die. And he was terribly afraid of death and thinking, oh, it's completely the end. There's nothing there. And he died. And a couple of weeks after his death, his wife called and said, can I come in and see you? And I think this is very important, because when someone's dying, it's not just about them. It's about everybody who loves them. And she said, I don't remember what the patient's name is anyhow, but so I'm making up a name, which I would have done in any case. She said, David was very afraid of dying, as you know, and was really in denial, and he had a terrible death. It was painful. He was screaming. He was frightened. It was a terribly traumatic experience for her. And then she said, I came back from the hospital after he passed, and I was sitting outside in a rocking chair, and he appeared to me in a full 3-dimensional vision. And he said, I am so sorry that I frightened you. And he said, death is beautiful, and I'm in a beautiful place. And he had a very meaningful exchange. And then he said, I want you to go and make an appointment and go see Joan and tell her this experience, so that she can share it with other people and they won't be afraid to die. And, what can I say? That's a grace. And these experiences, there was a paper written in 1926 about a variety of shared death experiences. It's not that unusual that people know that a loved one has died, even though they haven't heard and, they're nowhere around. They know or a vision comes to them, or a feeling comes to them, or, they have, like I had with my mother, my son and I both had, as you know, what Raymond Moody calls an empathic death experience, where you go into the light and have almost like a near-death experience, except you're not dying, your loved one is dying. So in those 2 weeks, when I thought, like, uh-oh, ovarian cancer, this is not a good, this is not going to be good. I was not afraid of dying, of death, but I was definitely fearful of the process that would happen, of treatment, of relapse, of, all the kinds of things that happen with that diagnosis. And yet also hopeful. There's still, remember Bernie Siegel? Bernie Siegel had founded ECAP, Exceptional Cancer Patients. And I have a friend with ovarian cancer, and she said, look, ECAP has got all these fascinating case histories. And if anybody can be an exceptional patient, it's you. But in the process of this, you two, all kinds of stuff came up. Sometimes great peace, sometimes great fear. After it was all over and I had a good prognosis, the whole process had been so intense. And what Gordon and I had done was like go deeply into meditative processes. Years ago, I used to do Tibetan dream yoga and had gotten to the point where I could wake up in the dream state pretty easily, pretty often, and then hadn't done it for 20 years or so. So we started the practice of Tibetan dream yoga again. And then, in a strange way, it was an anticlimax to realize, oh, not dying over here. This is interesting. And after, a couple of days of great celebratory relief, I got depressed. And I thought, okay, having gone through this, what is this experience to me? How do I hold it? How do I not go back to life as usual too quickly? Because standing on the precipice of death is kind of a shamanic initiation. I mean, I had a major surgery. I have an incision that goes up from my pubis to up over my belly button. And like everything inside basically was removed. So that's a shamanic experience of dismemberment. Mm-hmm. And I'm still in deep reflection. What does this mean to me? What am I called to do in this part of my life? Other than the most obvious thing, which is love the one in front of you. Get out of your own way. But now I think part of my calling is really working with people who are older, as we are, because I'm almost 76 and Gordy is almost 78. And our friends are getting sick. Many of our friends have died or are dying. It's been a kind of big year of transition. And there's not much of an opportunity for people to talk about death and dying in our society. It's just because we're not a society that dwells on that. And we're not a society that understands how to grieve. Because I find even in the aging process, especially in the aging process, there's a lot to grieve. Things that you just have to adapt to in the process, things that you can't do that you used to do, the loss of certain facilities. And there's a tremendous gain and gift in other ways. But I think often we focus more on the loss than on the gifts. So there's a lot there to unpack. I hope I didn't go on and on too long.
No, not at all. I wanted to share with you, Joni, that when we got the news, and thank you for sharing with us on what I imagined was a shorter list of people that you shared the news about, the diagnosis. It was obviously just a kick in the stomach of, oh my goodness, and where is this going? And our beloved friend, and how can we support? And I'm sharing this partly because of the other facet of, when you started talking about your husband, Gordon, and his peace, and then the people who love him are having a different experience from that peaceful experience. I mean, I was having an unpeaceful experience over here. And there was this kind of panic about how do I support you, and what is the quote unquote right way to be with someone who has this, because the first email was, this is ovarian cancer, right? And I had all the things that from my medical training experience of being on the gynonc service and seeing difficult situation after difficult situation, and the barbaric attempts, brutal attempts to try to advance the science, and so there was this kind of conundrum of wanting to kind of tell you it was okay that we wouldn't see you on the teaching stage because of what you were dealing with. And yet at the same time, there was this wondering about whether sort of releasing you from that agreement together could actually have a negative impact on your experience. And so I just wanted to share that because it's a delicate dance as a friend with someone who's gotten terrible news, and the helpful thing that you think you're doing, could have the opposite effect. It's very difficult, especially from a distance.
Yes, it is. It is. I remember during the years that my practice was all people who had acute or chronic illness, or sometimes just stress-related illness that would go away, which was great. But a very big part of it was family members, like trying to help the person who was ill. And what the literature has to say about that is help as little as you possibly can. If you overhelp, you disempower the person. And it's a tough line, even if you're there in the same house, let alone, in different cities as we are, to say, am I helping this person or am I hindering them? Am I saying, you're helpless, you can't do this? Or am I saying, take your time to heal and, we'll do what we can? It's a very, very delicate thing. And it was hard for me because, I get, as you know, a lot of joy out of teaching and sharing. And I thought, this is going to be a great loss for me if I can't do this anymore. And yet, I don't know what's happened to me. I've got this, thank God, now premature diagnosis of ovarian cancer. I'm going to have had surgery. Maybe I'll be in chemo. I can't tell these guys that I'm going to teach, because what if I'm busy with my head in the toilet throwing up, or, something.
Yeah.
So
It's wow. I mean, first of all, we are so delighted that the first diagnosis was wrong. Oh my God, I'm so relieved. So relieved.
Me too. And this is my I had cut my hair off in anticipation of chemotherapy. And so that I wouldn't have to, after surgery, deal with a bunch of long hair. So, this is still the growing in chemo cut, the aborted chemo cut. It was such a strange thing to be prematurely, erroneously diagnosed. It really was. And I'm still really thinking at some point soon I'll write about it. Having an experience of facing death for 2 weeks and then saying, oh, it was nothing. But years ago, by the way, when I was still living in Boulder, I had a misdiagnosis of a heart condition from, an excellent cardiology department at a Jewish hospital in Denver. And they told me I was in heart failure. That they told me, first of all, they said I had an open foramen ovale, and also I was in heart failure. And I thought, how could that be? I live at almost 9,000 feet, and I hike around. It just doesn't, I don't feel like somebody in heart failure. And I walked around for 2 years with that diagnosis before they finally said, oh, a mistake, you're fine. So,
oh my goodness. So this isn't your first rodeo, so to speak.
No.
There's a pattern happening here.
Wow. During those 2 weeks, Joan, was there any part of you that was questioning this ovarian cancer diagnosis, or were you pretty convinced?
Absolutely.
Yeah.
I was totally convinced. I was completely convinced.
Wow.
There was, to me, no question about it, because I had been read the riot act from the CT scan, and then the doctor, it was to be greeted with, well, you're in big trouble. And then literally in a 5-minute appointment, by the end of it, trying to be brought into a clinical trial does not leave you in a hopeful state.
No.
Were you assuming you were basically in a dying process that was not very far away?
I assumed I was dying. And that was why my first question to her was, do you think I'll live out a year?
I'm curious, during those 2 weeks, what did you do in your dying process, like that you thought you were in? How did you start engaging, whether with family? Like, how were you acting in your dying process?
Well, it was first I let the immediate family know, which was really difficult, especially for my children and the older grandchildren who could, see understand what it was. And that was really difficult, but also really wonderful, because they were also supportive. And it's a wonderful thing knowing that you're held. And you guys just were wonderful. Everybody was wonderful. But what I did, what you do when you're facing death is the same way you cope when you're facing life or any challenge. I sprung into action. So as you know, I reached out to you and I said, who's a good gynec person? And I reached out to friends of mine, radiation oncologist friend on the West Coast at City of Hope, and someone on the East Coast at Dana-Farber, and arranged that I could, but I'd have to go in person to either of these places. And I thought, quality of life. Do I really want to leave my house, leave my friends, and go to a strange place for treatment? These are the kinds of questions that you ask. But then on the other hand, it's your life that's at stake. And then I realized, look, any of the big cancer centers, there's no magic bullet waiting out there. I just have to make sure I have got a really good surgeon.
Mhm.
So it took me 2 or 3 days. I was on the phone, on the internet, looking for the best doctor. And I was fortunate in that I found an absolutely exquisitely remarkable physician right here in the middle of nowhere. I mean, I live in Santa Fe. I found someone an hour away in Albuquerque who actually has office hours in Santa Fe once a week. I thought, how could this be? This is fantastic. And I have to say, the minute I met her, I could feel my whole energy shift. And it was like, thank God, I am with the right person. It was
Yeah.
that was great. So to answer your question, a lot of it was, how am I going to manage this immediate thing? And then, because I was going into a very big surgery, I thought, well, you got to get your affairs in order. So this was,
So
this
it was really
making,
like a management
so
process for you.
we were already getting our will in order when Gordy
Yeah.
had his heart attack.
Right.
And we weren't finished. We were in process, and it's like,
Wow.
I'd let it go for a while. I'd get back to it because I'm the one who tends to manage. In every marriage, somebody usually takes the lead in different areas. I'm the financial person, so I'm like getting the will done. I called the lawyer and I said, Gordy's in the hospital. He just had a heart attack. We have to finish the will. We have to finish it now. And so it's like he gets out of the hospital, and 3 days later, we are in her office signing the will. And this was not so good because as time went on, I thought, we didn't do this right.
Yeah.
And I called her up. I said, back to the drawing board. Said my prefrontal cortex was offline after Gordy's heart attack, and I didn't pay close enough attention. She said not to worry. And so then I called her up again. I said, Jackie, it looks like I'm dying now. We have to finish the will.
We need you again.
Oh, man.
Wow.
So
Yeah, it's just like it just speaks to the practicalities of life that come crashing in our face when we're facing leaving the world.
That's
like,
right.
oh, we got to get all the practicalities done before we can relax into this process.
Yeah.
Well, that's exactly right. And then I was fortunate because my business partner sprang into action. And she said, we have to organize your whole support system. So she did that. She organized everybody to take care of me, to make meals, to do whatever was necessary. She made plans to come here for a week after the surgery. She created a Caring Bridge site for me. So this was, in a way, it was a great distraction. And then when we weren't doing that, I was watching videos of Tibetan Buddhist lamas. I had a stack of books about the afterlife. It's a great book, by the way, called After by Bruce Grayson, who's a psychiatrist who's been interested really in consciousness and does that continue after the death of the body. He's a great scientist, a great person. And After is a wonderful book, I think, for anybody to take a look at. As certainly, for anybody who takes care of people who are ill or has simply a lot of aging people in their practice, it's really good, really good to have a look at, well, what is this whole field of death, dying, and shared death experience, which is just beginning. There was just an article, and unfortunately, I was telling you before we started, I just got it yesterday. Haven't read it. Can't remember the journal it's in, but it's about the shared death experience. And how it is that psychiatry, for the most part, doesn't know about these experiences and can't help people who are alive integrate what happened when someone died,
Right.
or help a person who has an experience, a near-death experience, and comes back, can't help them integrate it. It's something that's just ignored in the training.
Mm-hmm. Yeah, I mean, it's definitely not something that we learn as psychiatrists, how to be with people in a dying process. Um,
Yes.
yeah, it's interesting. Yeah, I'm glad you brought that up. But it's not a rotation that you do as a psychiatry trainee, or medical trainee. There's so much emphasis on this kind of crusade against illness and the fight against illness, and the mystery and the beauty and um, the presence of being with someone who is transitioning is generally speaking completely off the reservation in terms of medical training. And it's considered almost psychologically like a failure to, inside the mind of a medical provider to acknowledge death, because then you're, putting your sword and your shield away and you're doing something else. It's sad. It's a missed opportunity. I'm happy that the palliative and hospice care movement has become much more mainstream than it ever was over the past many years. And there are alternatives for people now that didn't exist before in terms of the kind of violent deaths that would happen in the hospitals.
Yes. And, this was very important to me, Will. Just before Gordy's heart attack, literally 2 weeks before, one of our best friends, a physician who had been a hospice doc from Boulder, died. And it was in part due to him that the Death with Dignity law had been passed. He worked very, very hard on that. And actually, that's how he exited, with his whole family around him, when after a very, very long set of illnesses, the time had finally come to put down that sword and shield. And what I discovered was that finally in New Mexico, we had recently passed a Death with Dignity bill here. That gave me a tremendous amount of peace of mind, that if it got to the point where there was just suffering going on that was too much, I could make that decision. And that was wonderful. It also led to some very interesting discussions with friends about some of them saying, well, I would never make that decision for myself. And my saying, well, I want to know that when the time comes, I simply have a choice, because I too know until you're faced with whatever the situation is, you really cannot say what you will do. You can really believe with your whole heart you would or wouldn't do something. Right. And then at the moment, no.
You don't know. Right.
What emerges is something very, very different.
Yeah, it's also such a complex matter of life, of like this whole thing of like, how long do we fight for the person dying? How do we yield in ourselves and know when it's time to say, I'm going to yield into the process and stop fighting? And then on the other side of that is the medical profession of like, is it okay to not hold the stance that you're supposed to fight? Or is it okay to just support the person's wishes the whole way through, even if there's a fight that they would most likely win? Mm-hmm. Like, it's just this whole complicated piece of, our psychology around life and death. And, when do we yield into death? If it comes slowly, when do we yield into it versus fight to stay longer?
Well, exactly. That's so important. I have a very dear friend who is right now. According to all her doctors, she's dying, and she's had cancer for a good 25 years, and has really fought and managed and grown and helped others. She's such an exceptional person. And they finally said, look, we can't do anything else. There's nothing else left. It's time for hospice. And she was able to convince a doctor that she needed just one more round of chemo, one more try. And there's that too. It's like, right. Sometimes the doctor says there's nothing left and the patient wants to fight. It's not an easy thing. And it's important, I think, to talk about it, because there's all kinds of individual instances. I remember having a patient who he had melanoma, and this was 30 years ago, at a time that it was definitely a death sentence. And he had just had a recurrence, and it was in his brain, and it was all over. And the guy was an electrical engineer, and he tried to electrocute himself and failed. So this was, for me, what do you do when your patient with cancer tries to commit suicide? How do you hold that? How do you help them hold that? And fails. So I went and got supervision. There was at that time at the Mass General a psychiatrist, thank God, who was, this was his business, was death and dying. But what I realized right away is this brilliant electrical engineer must not really have wanted to die, because he failed in his attempt. I thought it was a half-hearted attempt. And it was very, very interesting to sit with him and his fiancée and talk about this, because he hadn't talked to her, and it was, for her, would have been a really difficult thing. And, for me, my own father jumped out a window when he had cancer because there was no one to talk to. And in his case, he had CLL, and the treatment for that involved high dose steroids. And he developed a manic psychosis, and there was no one to talk about with that. It was like, for my mother, my father was this gentle man who actually hit her in a shopping mall because he wanted to go into this store and buy a piece of really kind of crummy jewelry. My mother had beautiful jewelry, but he was in a manic state. She said no, and he actually hit her. Something he would never do. You couldn't talk to him. Just a constant flight of ideas, and what it's like. And finally, he got taken off those steroids to have a splenectomy, came into his right mind. It was really very interesting. I remember the night before he killed himself, he called on the phone, and it was the first real conversation I'd had with him for over a year, because he wasn't manic. He was so peaceful. And I thought to myself, preternaturally peaceful. Why is he so peaceful? In retrospect, he was peaceful because he'd made up his mind that he was going to jump out the window. And it was the goodbye call. But I thought to myself then, it's like, we know so little. Now, at least, you've got consultation liaison services. Right. Back then, there was nothing. But I think about the suffering that our family went through because of that. and how my mother then suffered. It's like, why wasn't I up at 3 a.m. to prevent him jumping out a window? As you know, she was a helicopter wife, just like she was a helicopter mother. The survivor guilt that happened after that was really difficult. And you guys know this story well because I've told it, when I was teaching for you. But for me, the survivor guilt was so great because I was a cancer cell biologist, and I thought, why couldn't I have been more helpful? Why was there nothing that I could do? Why did I let him jump out a window on my watch? We all took it personally, like we could have done something differently. And my way of dealing with that was retraining, and getting licensed as a psychologist and immediately going to work in this area of stress and chronic illness and acute illness, with the hope that maybe one more family would have a better outcome than our family did. But that's, it's these death and dying experiences are powerful. They are vivid. They are deeply emotional, so that they're fertile ground, on the one hand, for falling apart and never recovering. My mother became a hermit for 13 years till her own death. She wouldn't even see anyone. That can be the outcome. Or for me, it led to a total transformation of who I was and what I wanted to do in the world. So they're fertile ground for something to happen, for good or for ill. And in working with clients, to be able to listen and to be present and to be able to help people to see the possibilities, to see these things in a certain way as an initiatory experience into some new way of being is just so important. And we really aren't trained to do this.
Right.
I think that's a really good place to start closing. I guess I'll just ask you, is there any last thing you want to say to the listeners about all of this? Anything you want to get across?
Well, first of all, I want to thank you too, because what you're doing is so important. Your programs are so fantastic. And I want to say thank you to both of you personally for supporting me through this program, because it's like been full circle. Just what I've been through used to be my business. That's what I did for years and years. And then it's humbling, I think, for all of us. Here we are, we're so concerned with people's physical and mental health. And eventually the moment will come for each one of us when we are going through this ourselves. And we can look back and say, what did I learn? What did I learn from my patients? What did I learn from friends, from family who have faced illness or faced mortality? And I would say we're all very fortunate because we can pull on all these things. But in ending, I would say, we don't go through this alone. And the degree to which we have people around us who love us, who listen to us, who are there for us, is the greatest grace in the world. So thank you both.
Thank you,
Joni.
Joni.
Back on the show.